Hey guys, what's up? It's Dr. Nevel, aka Dr. Ginger Ninja. Today we're introducing 5 different treatments for tennis elbow. I got Laura with me, and Laura, you have tennis elbow here that you're not really sure the cause of?
It seems to flare up when I travel.
It's still inflamed on the bone right there. Push your arm against me here, bring that wrist back, resist me there. Okay, now that recreates pain there?
Yes.
Okay, that's usually a common orthopedic test for tennis elbow if that recreates pain. So tennis elbow is also called lateral epicondylitis. Itis usually means inflammation, and the lateral epicondyle is this attachment where the bone is here, where the extensor tendons attach to the bone. So the first thing we're gonna do is start off with an adjustment of the elbow. So now we're going to do treatment number 2, which is Graston instrument-assisted soft tissue mobilization. Graston is a great way to treat tennis elbow and break up scar tissue. All right, while I'm doing this, let's bring your wrist back and then flex it forward, back and forth. So we've done an adjustment, we've done Graston, and next, treatment number 3, we're going to do dry needling and electroacupuncture with Dr. Therese DeTolo.
I'm going to put some here, and I'll palpate around, see if we have any trigger points I can get, and then I'm going to put some above, and we'll do some stim surrounding this area, and that's going to help alleviate that inflammation. It'll help kind of bring you to the source of where the pain is really stemming from. So it can be more forearm, it could be bicep, not just the elbow.
Right.
So that's what we're gonna figure out. So these are the needles I use with dry needling, and they're single use filiform needles. Here first. Ooh, nice. Did you feel that release? Awesome. That was great. So what you just felt was a trigger point in your forearm. So that twitching was the release of the trigger point, which is great. So you're gonna wanna drink a lot of water because it'll help flush out some of the lactic acid that was building up within the muscles. So typically with the needles, 15 minutes is about the average rule of thumb that you can do. Depending on the severity of the case, you can do longer or you can do more stimulation for less retention time. So I'm gonna set up the stim, and they're kind of like mini jumper cables, so it's different than the other TENS unit with the patches. This we're gonna actually clip right onto the needles. So what this is gonna do is help put a frequency through the muscle, which is in turn going to help continuously release the trigger point, and that's going to ultimately alleviate pain and inflammation that's going on. You might feel the muscle jump a little bit, it might twitch, it might tighten. All of that is great, and you want to feel that. I go very, very slow because it is sensitive, so you might feel like a tapping, a buzzing, kind of a circling feeling. Every patient feels something different, but when you become aware of the sensation, then just let me know, because then I'll know how much more to turn it up. And just let me know when you become aware of any sensation.
It feels like it's tingling a little.
So now that she's at a comfortable setting with the stim, we're gonna leave her here for about 10 to 15 more minutes. In about 4 to 5 minutes, what I'm gonna do is I'm gonna come back and we'll reassess where you're at with the sensation.
Okay.
Because what's gonna happen is your body will get used to it and it might subside completely. Even though it's still on and working, you might not necessarily feel it as strong.
Okay.
So we'll then reassess and increase as we wait.
And treatment number 4 is high-powered laser therapy to help reduce inflammation and increase healing. So with a class 4 laser therapy, what we're doing is actually pulsing the laser faster than the eyes can see. And what it does is it reduces the thermal effect, so there's no heat produced. If we had this on a continuous laser therapy, we would have to keep this moving around so that we don't overheat the tissue. So what laser is doing is actually penetrating the laser deep into the muscle to help stimulate the healing and reduce inflammation. So laser often creates a lot of pain relief, sometimes immediately, sometimes it can take a few visits, but what it's doing is the laser actually stimulates the mitochondria to produce more ATP, which is the energy molecule of the body. Yep, just an excuse to put on these cool glasses so that everybody realizes how cool I am. And the 5th and final treatment is kinesio taping to help support all those muscles of the elbow. The tape will last about 2 to 3 days and create continuous support. All right, Laura, how's that feeling? Is that feeling any better?
Already feeling better. You're amazing. Thank you.
Absolutely, thank you. If you want a detailed how to kinesio tape tennis elbow, check out this video. And if you liked this video, punch that like button, subscribe, and we'll see you in the next video.